What would you do if an entire town blamed you for a patient's death and exiled you to an abandoned manor clinic? At 21, Nurse Clara Bell had lost her position, her reputation, and every person willing to defend her. The clinic had been locked since a fever outbreak 28 years earlier, yet one treatment room remained strangely untouched by dust. Inside, Clara discovered a ledger listing patients the town claimed had never existed, including her own mother. Before she could read the final pages, someone broke into the clinic and tried to burn them. Now Clara had to restore a place everyone feared while proving that the old epidemic was not the disaster recorded in history and that the respected physician who condemned her was protecting a secret inherited from his father. Clara's fall began with a glass of water. The patient was Edith Marlowe, a seamstress admitted to St. Cuthbert's Infirmary with an infected hand. Dr. Victor Harland ordered laudanum for pain and a poultice prepared by his assistant. Clara noticed that Edith's breathing slowed sharply after the evening dose. She checked the medicine bottle and found its label smeared. The liquid smelled stronger than the diluted preparation listed on the ward sheet. Clara withheld the next spoonful and sent for Harlan. He arrived, angry, declared Edith agitated rather than poisoned, and ordered the dose given. Clara refused. While they argued, Edith convulsed and died. Harlan told the inquest that Clara confused bottles while cleaning the cabinet, delayed treatment, and gave the patient unboiled water against standing orders. 2 attendants dependent on him confirmed his account. Clara's own notes disappeared from the ward book. The jury found no criminal act but censured her negligence. St. Cuthbert's dismissed her before sunset. Harlan then offered the town council a solution: Hawthorne Manor Clinic, abandoned since the fever year of 1859, required a resident caretaker to preserve the council's insurance claim. No respectable person would live there. Clara could accept the post with a salary of 6 shillings a week or leave Ashcombe within 48 hours. Council members called it mercy. Everyone knew the manor stood beyond the marsh road where 32 fever patients supposedly died. Villagers believed their voices remained in the locked wards. Clara did not believe in voices, but she understood damp walls, contaminated wells, and public fear. 6 shillings would barely buy food and fuel. Refusal would mean the workhouse, or walking to a city where Harlan's letter would arrive before her. She accepted the keys. Her father had died when she was young. Her mother, Eleanor Bell, vanished during the 1859 outbreak when Clara was an infant. The town told Clara that Eleanor abandoned her and probably fled overseas. Clara had been raised by an aunt who never spoke of Hawthorne. The clinic's gates leaned beneath dead ivy. Hawthorne Manor had once belonged to a wealthy family, then became a charitable fever hospital under Lady Anne Hawthorne. Its central house remained imposing despite broken windows. 2 ward wings extended behind it, joined by a covered passage. Marsh reeds crowded the lower garden, and the stone well wore an iron cap. The council clerk, Mr. Dobb, would not enter. He handed Clara a property inventory copied 20 years earlier and advised her to sleep in the gate lodge. Clara instead walked through the main door before daylight failed. Dust covered the entrance hall deeply enough to hold every footprint. Rain had collapsed part of the south corridor. Mice nested in linen cupboards. Rusted bed frames filled the men's ward, yet the building did not smell as rotten as expected. Air moved faintly through wall grills. Lady Hawthorne had designed ventilation ducts, unusual but not impossible in a progressive clinic. Clara selected a small reception room near the entrance for shelter. It had a sound fireplace and 2 shutters she could repair. While carrying blankets from the gate lodge, she noticed a draft beneath a locked door at the end of the north wing. The inventory called it Treatment Room 4 and described it as fire damaged beyond use. The key ring held no matching key. Clara removed the hinge pins rather than break the lock. The door opened inward without resistance. Inside, white sheets covered a table and glass cabinets. No dust lay on them. The room was not untouched by time. Someone had cleaned it recently. A narrow copper vent entered beside the fireplace, warm though no fire burned. On the desk rested a leather ledger. Its first page read, Hawthorne Auxiliary Ward. Admissions withheld from parish return by order of Dr. Augustus Harlan. Victor's father had directed the clinic during the old outbreak. Clara turned pages. The listed patients were mostly laundresses, factory children, marsh laborers, and unmarried mothers. Official histories named none of them. Beside each entry appeared water source, Symptoms, treatment, and outcome. Many recovered. On page 47, she found Eleanor Bell. Age 19. Occupation, kitchen maid. Admitted with infant daughter Clara. The entry did not say abandoned. It said transferred to lower isolation for protection after witnessing contamination of East Pump. Clara's hand shook. Final disposition appeared several pages later. But those pages had been sewn together along the outer edge. She fetched a small scissors from her nursing case. Before she cut the thread, glass broke in the corridor. A masked man entered carrying lamp oil. He struck the candle from her hand and reached for the ledger. Clara drove the scissors into his sleeve. Not his flesh. Pinning cloth briefly to the table, he tore free and poured oil across the desk. She threw the ledger into the empty hearth and smothered the flame with a sheet. The intruder escaped through the window, leaving a strip of gray coat and the sharp scent of carbolic soap used at St. Cuthbert's. Clara carried the ledger to the gate lodge and sat awake until morning. Someone knew exactly where it lay. Someone had maintained the room, kept the warm ventilation line working, and returned to destroy evidence when she arrived. At dam, doctor. Harlan came with Constable Voss. Harlan claimed smoke was seen from the road and accused Clara of nearly burning council property on her first night. She showed the broken window and torn coat strip. Voss found no footprints because frost hardened the ground. Harlan picked up the ledger with gloved hands and called it a fever record unsafe to remove. Clara did not release it. Why were these patients withheld from the parish return, she asked. Temporary admissions were often omitted. Why is your father's order written here? His composure tightened. He said old records belonged to the council and ordered Voss to seize it. Clara read the caretaker agreement. It made her responsible for preserving contents pending formal inventory. Removing the ledger without a receipt would place her in breach. Voss refused to take responsibility. Harlan left, after warning that a disgraced nurse living alone in a ruined hospital should avoid imagining conspiracies. His carriage bore a fresh scratch where gray paint showed beneath black lacquer. The torn coat strip matched the gray livery of his driver. Mr. Crane. Again? Suspicion was not proof. Clara copied the ledger's first 50 pages before examining the sewn section. The thread was new, but needleholes beneath it were old. Someone had opened and resealed those pages repeatedly. Inside, Eleanor's record continued. She worked with Lady Hawthorne and Nurse Beatrice Wynne to compare water from the East Pump, Manor Spring, and Marsh cottages. Patients using the East Pump became ill at 3 times the rate of those supplied from the spring. Augustus Harlan dismissed the observation as female speculation. He ordered the auxiliary patients moved to the lower isolation rooms near the contaminated pump, supposedly to protect the main ward. Several died. Eleanor did not. Her final entry read, discharged secretly with child under protection of B. Vune. Statement deposited in medicine lift. The town's claim that she abandoned Clara was false. But the record still did not explain why Clara grew up without her. A separate note said Eleanor returned 3 weeks later and was detained by order of A.H. No further entry followed. Clara searched for the medicine lift. Old plans were missing from the inventory, but small square doors appeared beside cabinets on all 3 floors. Their shaft had been bricked up in the basement. Treatment room 4's warm vent followed the same wall. Clara lacked tools and could not safely dismantle it alone. She first needed food, heat, and witnesses. Ashcombe residents avoided her, but not everyone admired Harlan. Jonah Price, a carpenter whose daughter Edith had been the dead seamstress's friend, agreed to repair the reception shutters after Clara showed him Edith's copied ward notes. Clara had reconstructed them from memory the night of the death, including bottle appearance and dose times. Jonah recognized the medicine cabinet because he built it. Its shelves sloped slightly. Bottles could roll together, but only if their wooden separators were removed. Harlan told the inquest Clara removed them. Jonah had repaired the cabinet 1 week before Edith's death and saw Harlan's assistant take the separators out to repaint them. The work was never completed. This did not prove who mislabeled the bottle, but it contradicted Harlan's certainty. Jonah entered Hawthorne in daylight and found the warm vent. It connected to a small boiler in a rear service room. Whole ash inside was less than a week old. Someone had fired it to keep treatment room 4 dry. The boiler also powered the old medicine lift. Through a steam-assisted counterweight, Jonah repaired the manual wheel while Clara cleared the shaft from above. Behind the basement bricks, they discovered a maintenance door. It had been opened recently and closed with loose mortar. Inside the shaft, wedged above the lower pulley, rested a tin dispatch cylinder. Eleanor's statement was gone. In its place lay a card bearing Victor Harlan's handwriting. Some histories are merciful because they end. Clara showed the card to Jonah before touching it. He wrapped it in clean paper and signed the date. They now had evidence of Harlan's access. Though he could claim the card was stolen and planted, more useful was a patch of blue wool caught on a nail. Mr. Crane wore blue gloves. Clara resisted the urge to confront him. The ledger's clinical pattern mattered more. She spent days tabulating admissions, water sources, dates, and outcomes. Her skill was nursing, not advanced mathematics. But frequencies were plain enough. Fever clustered around the east pump. When Lady Hawthorne ordered spring water carried to the wards for 9 days, new cases fell sharply. Augustus Harlan reversed the order. Citing cost and discipline, cases rose. His published account later credited recovery to his tonic and strict isolation. The ledger showed that the tonic had no consistent benefit. Clean water and separated utensils did. Hawthorne did not hide a miracle cure. It hid neglected observation and a deliberate choice to preserve a physician's authority over poor patients' lives. Restoring the clinic required making that observation useful now. Clara sampled the capped well, spring, marsh pumps, and St. Cuthbert's kitchen tap in boiled glass bottles. Without a modern laboratory, she could not identify organisms, but she could compare odor, sediment, reaction with soap, and changes after standing. The east pump and infirmary tap both carried faint organic. Town drains had expanded since 1859. St. Cuthbert's water pipe crossed below a leaking cess trench near Harlan's private stable. Edith's unboiled water may not have killed her, but the infirmary supply was not safe. Clara asked the council to inspect. Harlan called her tests amateur theatrics. The council refused. She placed sealed samples in the window of Hawthorne's reception room with dates and sources. Within 4 days, the infirmary sample clouded, while the spring sample remained clear. People stopped to look from the road. Harlan ordered Dobb to remove them as a public nuisance. Clara's caretaker contract allowed displays relating to property preservation. The samples stayed. A mother named Rose Fenwick came after dark. Her 2 children suffered recurring bowel illness whenever rain flooded the stable lane. Harlan charged for tonic she could barely afford. Clara boiled spring water, cleaned their vessels, and taught Rose to keep waste downhill from the household pump. She made no promise of cure. The children improved over the next week. Word spread quietly. Hawthorne's reception room became a place where poor families asked questions they could not afford to ask Harlan. Clara treated small wounds, changed bandages, and referred serious cases rather than pretending the ruined clinic was ready. She charged those able to pay pennies and recorded every visit. Jonah repaired 1 additional room. Rose washed linens. An elderly former nurse named Beatrice Wynne arrived on the 12th day carrying the missing key to treatment room 4. Beatrice was 76 and walked with 2 sticks. She had not returned to Ashcombe in 20 years. The newspaper account of Clara's dismissal reached her through a former pupil, and Harlan's mention of Hawthorne convinced her that Augustus's son was searching for the ledger. Beatrice confirmed that Eleanor fled with infant Clara after discovering the pump pattern. She planned to testify at a county inquiry. Augustus detained her on the claim that exposure made her contagious. Though she had no fever, Beatrice helped her escape a second time. But Victor's father used parish influence to obtain a warrant accusing Eleanor of stealing medicine. Eleanor left Clara with her sister for safety and traveled to meet an investigator. Her coach overturned on a flooded road. She died unnamed in a village infirmary because her papers disappeared after Augustus arrived to identify her. Beatrice kept silent after Augustus threatened to imprison Clara's aunt as an accomplice. "I told myself, silence protected you," she said. It also protected him. She had hidden a copy of Eleanor's statement inside the medicine lift, but when she returned years later, it was gone. Treatment room 4 remained clean because Beatrice paid Crane's predecessor to fire the boiler once each month and prevent damp from destroying the ledger. After that man died, Beatrice secretly paid Mr. Crane. Victor discovered the arrangement and forced Crane to report everything he found. Crane was likely the intruder, but Beatrice insisted fear made him an instrument, not the source. She unlocked a cabinet Clara had assumed empty. Its back panel contained Lady Hawthorne's correspondence with a sanitary reformer in London. The letters discussed separate water supplies, ventilation, washing hands and instruments with carbolic solution, and recording outcomes honestly. Augustus opposed these expenses while billing the charity for tonics, purchased from a company he partly owned. One letter referred to an enclosed diagram proving drainage contamination. The diagram was missing. Beatrice remembered Lady Hawthorne placing important plans beneath the floor map in the admission hall. The floor appeared to be ordinary black and white tile. Clara's measurements showed the border was wider on the east than west by 4 inches. Jonah lifted 3 tiles and found a shallow copper case. It held the original drainage diagram, invoices, and Lady Hawthorne's signed statement. Augustus had ordered a pipe from his stable and private house joined to the town's east drain upstream of the clinic pump. He knew seepage followed heavy rain but delayed rebuilding because it would expose unauthorized use of charity funds. The statement also named Eleanor as the assistant who discovered the pattern. Lady Hawthorne intended to remove Augustus. She died suddenly 2 days before the inquiry. Her death certificate, signed by Augustus, listed heart failure. Clara would not accuse him of murder without evidence. Fraud and suppression were already grave enough. The council scheduled a closed meeting after Harlan learned Beatrice had returned. He demanded Clara's dismissal as caretaker for operating an unlicensed clinic. Clara replied that she provided nursing assistance, not physician services, and invited inspection. Harlan arrived with 3 councilmen expecting filth. They found a clean reception room, boiler linens, labeled supplies, visit records, and separate waste containers. The usable portion of Hawthorne was safer than St. Cuthbert's crowded ward. Harlan shifted to the fire damage. Jonah showed that Treatment Room 4 had no fire damage at all. The inventory description was false. Dobb admitted he copied it from a list Harlan supplied. Clara then presented Lady Hawthorne's invoices showing charitable money diverted to Augustus's tonic company. One councilman, Alderman Vett, still supported Harlan because his textile mill relied on the doctor to certify injured workers fit for duty. Another, Mrs. Lister, asked why the evidence had remained hidden for 28 years. Beatrice answered before Clara could. Because respectable men required frightened women to prove the truth without frightening anyone. The council did not dismiss Clara, but it prohibited overnight patients until a full structural and sanitary inspection. This was reasonable. Though Harlan presented it as closure, Clara continued daytime nursing. She and Beatrice trained Rose to keep records. Jonah recruited masons to stabilize the North Corridor for wages deferred against future donations. Clara refused free labor from men whose families needed food. So, work proceeded slowly. A regional reform society purchased timber after reading Lady Hawthorne's letters. The aid came with no claim to ownership. Harlan attacked Clara's reputation instead. Handbills called Hawthorne a refuge for immoral women and accused Clara of inventing illness to attract donations. Anonymous complaints claimed she performed surgery. Inspector Forsyth, no relation to the Brackenford official, arrived unannounced and found no surgical instruments beyond a nurse's kit. Clara welcomed his report and posted it publicly. Harlan then sued for return of the ledger as private Harlan family property. Lady Hawthorne's charter stated that all clinical records belonged to the charitable trust, whose successor was the town council. He lost the preliminary claim. The hearing forced him to reveal that he knew the ledger's exact shelf location despite insisting he had never entered Treatment Room 4. Mr. Crane broke under questioning. He admitted maintaining the room under Beatrice's payments, later giving Harlan access, and entering on Clara's first night. Harlan ordered him to burn the sewn pages and stage an accident. Crane refused to pour oil near Clara, intending only to frighten her. But panic led to the struggle and fire. He surrendered the missing Eleanor statement, which he had hidden rather than destroy. It matched Beatrice's account and Lady Hawthorne's diagram. Crane accepted a charge of breaking and entering. Clara asked that his cooperation and coercion be considered. He was not innocent. But punishment need not erase differences in responsibility. Harlan dismissed him and denied every instruction. Clara's reconstruction of Edith Marlowe's death remained separate from the old scandal. The bottle recovered from the infirmary had been emptied and washed, yet Jonah's testimony about shelf separators prompted the coroner to reopen the file. The dispensary assistant admitted Harlan ordered him to prepare a concentrated stock solution. then left it on the ward shelf because the locked cabinet key was missing. Harland expected nurses to recognize it by bottle shape. Its label later became wet. Clara had not mixed the bottle or caused Edith's first fatal dose. More painfully, records showed that by the time Clara withheld the next dose, Edith had likely absorbed a lethal amount. Clara's refusal was correct, but could not save her. Harland blamed her to conceal an unsafe system and his own order. The revised finding cleared Clara of negligence and censured St. Cuthbert's medicine controls. Harland retained his license, pending a professional hearing. But his authority in Ashcombe weakened. Patients still came to him. He was the only physician for miles. Clara understood that exposing him without building alternatives could leave the town medically abandoned. Hawthorne needed a qualified doctor, committed to its methods. Beatrice contacted Dr. Samuel Okoro, a physician trained in Edinburgh who had worked at a port fever hospital and faced repeated rejection from English county posts because of his West African birth. He did not arrive as a convenient savior. He requested Hawthorne's accounts, inspection reports, water tests, staffing plan, and guaranteed independence from the council faction that protected Harland. Clara sent everything, including failures and missing funds. He agreed to visit for 1 month. Dr. Okoro confirmed that Clara's observations justified a formal sanitary survey, but warned against claiming that clear spring water was always safe. Appearance alone could mislead. He introduced improved sampling and arranged analysis through a university colleague. Results showed severe fecal contamination in the east pump and intermittent contamination in St. Cuthbert's supply after rain. The manor spring was substantially cleaner but required protection from surface runoff. Their joint report recommended closing the east pump, repairing drains, moving the stable waste channel, and boiling water during construction. Harland called the laboratory biased. Then, 3 mill households near the pump developed severe fever within 1 week. Clara and Okoro traced their water deliveries, isolated patients in the repaired north rooms under council emergency authority, and supplied boiled spring water to nearby houses. They did not promise certainty about cause. They acted on the strongest available pattern. New cases slowed. Hawthorne's feared wards reopened, not as a place of exile, but as the town's most organized refuge. The emergency exposed Hawthorne's weaknesses immediately. Its north roof leaked over 2 beds. Coal lasted only 9 days, and the spring path became mud under delivery carts. Dr. Okoro refused new admissions beyond what staff could safely manage. Harland accused him of turning away the sick. Clara posted the bed count, staffing hours, and reasons for each referral. Limits stated publicly were harder to twist into indifferent. Rose Fenwick organized household water carriers in pairs, so no one worked alone at night. Beatrice trained volunteers to boil cloths, scrub vessels, and separate clean from used linen. Jonah built foot-operated washstands from discarded pump parts. Treatment remained careful rather than miraculous. Some patients worsened despite every measure. 1 elderly mill worker died. Clara recorded his decline without hiding it from the window report. Hawthorne gained trust because it told the truth about failure as plainly as recovery. The town council finally closed the east pump after the university analysis arrived under official seal. Alderman Webb delayed the drainage repair vote, arguing that the mill could not afford interruption. The contaminated trench crossed land owned by his company. Clara presented a route allowing work in short sections while the mill continued at reduced capacity. Webb still refused because the cost would reveal years of neglected maintenance. Families marched to the council carrying cloudy water jars. They did not demand belief in Clara personally. They demanded that officials compare the jars with laboratory reports and rate maps. The repair passed by 1 vote. During excavation, workers found an illegal clay pipe from Harland's stable, joining the public drain. It matched Lady Hawthorne's diagram almost exactly. Victor had rebuilt the connection after inheriting the property. Despite access to his father's records, his solicitor claimed he did not know where the pipe discharged. A stable account showed he paid for the work and specified the old route. Harland's medical hearing expanded into an inquiry about public safety, full, and witness intimidation. He remained free and retained loyal patients. Respect, built over decades, did not vanish in a week. Some townspeople said Clara's campaign brought shame on Ashcombe. Others feared Dr. Okoro because newspapers described him as a foreign agitator. Harland encouraged both reactions without signing his name. Hawthorne answered by making its practices observable. Families could watch linen processing from the covered passage. Drug inventories required 2 signatures. Every death received a case review, including a nurse, physician, council representative, and when possible, a relative. Fees were posted. No patient was photographed or displayed as evidence. The clinic would not defend dignity by sacrificing privacy. Harland found another weapon in property law. Lady Hawthorne's charitable trust required a licensed physician as superintendent and annual reports to trustees. The last surviving named trustee died 18 years earlier. Harland argued that the trust had failed, and the manor reverted through a distant Hawthorne heir who had sold him an option. If the court recognized the reversion, he could evict Clara and close the clinic, regardless of the council's caretaker contract. His option cost only £50 because the heir believed the property worthless. Mr. Dobb found no successor clause in the council copy of the charter. Clara searched the manor archives, but several pages had been cut from the trust book. Beatrice remembered Lady Hawthorne discussing a living board chosen from nurses, patients, and parish residents. If family trustees ended, the clause might exist in correspondence, but memory would not defeat a deed. Harland scheduled a possession hearing for 6 weeks later. Repair donors withdrew. Merchants refused credit. Clara had 8 patients, 11 daytime cases, and less than £4. Dr. Okoro's trial month ended. A hospital in Bristol offered him a secure post. Clara expected him to accept. He declined for reasons that were neither romantic nor heroic. Bristol required him to serve under a superintendent who had already questioned his credentials. At Hawthorne, the council recognized his authority. Patients trusted his work, and the sanitary investigation interested him. He agreed to a 1-year contract if governance became lawful and wages were guaranteed for all staff, including Clara. He would not work in a charity sustained by unpaid women. Clara's 6-shilling caretaker wage became a nurse's salary funded from emergency subscriptions and modest patient fees. Rose received pay as ward attendant. Beatrice refused a wage until Clara showed that refusing allowed officials to treat training as valueless. She accepted a small stipend and donated part back openly. Searching for the successor clause led Clara to Lady Hawthorne's family chapel. The trust book referenced annual reports deposited beneath the names of those served. The chapel memorial listed the Hawthorne family in marble, but no patients. In the graveyard behind it stood an unmarked stone wall built from small tablets turned inward. Jonah loosened one damaged section under church permission. The hidden faces bore names, age, and occupations of auxiliary patients. Lady Hawthorne had created a memorial concealed when Augustus persuaded the parish that naming fever victims would frighten trade. Behind Eleanor Bell's tablet was a narrow zinc box. It contained no successor clause, only a list of 32 patients publicly declared dead. The ledger showed that 19 recovered, 7 died, and 6 were transferred. Augustus inflated deaths at Hawthorne to justify closing the clinic and conceal patients moved after contaminated water exposure. 1 dead child. Benjamin Lista later appeared in school records under the same birth date. His daughter was Councilwoman Lister. Her family believed Benjamin's early years were lost because he arrived at their household as an orphan. In fact, his mother survived and sought him for years. Harland's father had separated families to prevent testimony. Mrs. Lister used her council authority to open sealed parish correspondence. Letters from 3 recovered patients had been retained but never delivered. One envelope bore Lady Hawthorne's note: if trustees fail, convene those named in Schedule C, according to the duplicate charter held by the Charity Commission. The National Commission's archive contained the duplicate. Schedule C empowered a successor board consisting of the superintendent, head nurse, 2 former patients or descendants, 2 rate-paying residents, and 1 council delegate. The trust had not failed. Its board simply had not been convened. Clara, Dr. Okoro, Mrs. Lista, Rose as a patient's mother, Jonah, a shopkeeper named Abdul Karim, and a council delegate formed the first lawful board in 28 years. They rejected Harland's reversion option. The court agreed that the distant heir possessed no interest to sell. Harland lost the manor before he could enter it. The hearing also revealed that Mr. Dobb had known of the commission archive, but omitted reference because Harland paid his son's medical school fees. Dobb resigned and returned the money through the council. His cooperation helped reconstruct missing inventories but did not erase his concealment. Hawthorne now had legal standing. Yet Harlan still controlled St. Cuthbert's and many medical records. Before his professional hearing, the infirmary dispensary caught fire. The blaze destroyed the cabinet involved in Edith's death and threatened archived casebooks. Harlan called it an accident caused by a lamp. A porter saw Mr. Crane's replacement leaving the room, but the man vanished. Constable Voss found a tin of accelerant used in Harlan's stable. Clara feared the case would again rest on suggestive objects. Then Rose discovered that one patient transferred from St. Cuthbert's carried a blanket smelling strongly of smoke. Sewn into its hem were 3 ward books. The night attendant, Mary Sloane, had hidden them before raising the alarm because she saw Harlan's assistant piling papers near the lamp. Mary brought the books to Hawthorne after Harlan accused her of setting the fire. The records showed repeated medicine errors, falsified supply charges, and altered outcomes. Edith's original ward entry remained in one book beneath a pasted sheet. Clara's notes had not vanished. Harlan covered them. Her handwriting recorded the concentrated bottle, slowed breathing, withheld dose. An immediate message sent to him. His later edition accused her of delay. Ink analysis could not determine an exact hour, but the physical layering proved his note came after hers. Mary's testimony established that he ordered the page replaced after Edith died. At the medical hearing, Harlan's counsel argued that public controversy had influenced every witness. Clara agreed controversy could influence memory. She therefore based her testimony on documents created before it, her original layered entry, Jonah's dated cabinet repair, dispensary stock orders, Edith's dosing sheet, and the assistant's preparation record. Beatrice did the same with the 1,859 ledger, Lady Hawthorne's letters, drainage invoices, and Eleanor's statement. Dr. Okoro presented laboratory results without claiming they proved every historical case. Their restraint strengthened the evidence. Harlan could attack motives more easily than aligned records. He was removed from St. Cuthbert's pending judgment, then struck from the medical register for falsification, unsafe drug management, and concealment. Criminal charges followed for the Hawthorne break-in conspiracy, infirmary arson conspiracy, fraud, and obstruction. The assistant who set the dispensary fire was arrested in another county and testified that Harlan paid him. Victor received a prison sentence. The inquiry did not charge him for the 1,859 deaths because he was a child then. It did establish that he knowingly preserved his father's false history, maintained the contaminated drain, destroyed evidence, and sacrificed Edith's reputation and Clara's to protect himself. Augustus Harlan's posthumous honors were removed from St. Cuthbert's. Lady Hawthorne, Eleanor Bell, Beatrice Wynne, and the auxiliary patients were added to the official outbreak record. The revision did not claim that they discovered all causes of fever or possessed knowledge beyond their era. It recognized that careful observation, cleaner water, ventilation, and honest records saved lives while authority suppressed them. Clara's vindication brought invitations from newspapers and hospitals. She declined offers that described her as the nurse who defeated a doctor. Dr. Okoro had warned her that institutions often celebrated individual courage to avoid changing systems. Clara's goal was not to become an exceptional woman permitted to speak. Hawthorne needed procedures through which ordinary nurses could record concerns without losing their livelihoods. The board adopted protected incident logs, 2-person drug checks, independent case reviews, and direct access to trustees for staff. No physician, including Okoro, could remove a nursing entry. He supported the rule precisely because good governance should not depend on his character. St. Cuthbert's faced closure after Harlan's conviction. Hawthorne lacked space to absorb all care. Rather than let rivalry harm patients, its board proposed merging the sound St. Cuthbert's building into the Hawthorne Trust while keeping the Manor Clinic for isolation, training, maternity care, and poor patients. Creditors objected. The council purchased the infirmary through public bonds repaid by rates and fees, scaled to means. Residents argued fiercely over cost. The board published budgets showing what untreated outbreaks, workplace illness, and emergency burials already cost. The measure passed. Ashcombe gained one coordinated system, instead of two institutions competing through rumor. Restoration remained slow. The manor's south wing required demolition. The north roof took 2 summers. Drainage works exposed unstable foundations. A national donor offered enough money to rebuild everything. If the clinic adopted his family name, the board refused naming control but accepted a smaller, unrestricted gift. Hawthorne retained the name of the woman, whose original trust included governance by those served. Clara moved from the gate lodge into a modest room above reception, only after the roof was certified. She kept the first burned sheet from treatment room 4 folded inside Eleanor's ledger, not as proof, but as a reminder of how nearly evidence vanished. The first year after the merger was harder than the trial. Harlan's conviction created the impression that removing one corrupt physician had repaired Ashcombe's health. In reality, the merged service inherited unpaid bills, exhausted nurses, a leaking infirmary roof, and households suspicious of fees. Clara served as head nurse at 23. Younger than 2 women she supervised. 1. Nurse Agnes Pollard resented taking instruction from someone once censured. Clara did not demand personal loyalty. She asked Agnes to lead the first audit of medicine storage because Agnes knew St. Cuthbert's routines better than anyone. Agnes found 6 unlabeled concentrates, duplicate keys, and an ordering system that encouraged substitutions. Her recommendations became policy. Respect grew from useful authority, not forced reconciliation. Hawthorne's incident log soon tested the rules. Dr. Okoro prescribed a fever mixture at a dose appropriate for an adult. A junior nurse almost gave it to a small 12-year-old because the child's age was copied incorrectly. The 2-person check caught the mistake. Okoro signed the incident report himself and discussed it at review. Some board members wanted the report hidden to protect confidence in the new clinic. He refused. If Harlan's errors belonged in public evidence while his own remained private, reform would become another reputation system. The anonymized lesson was shared with regional hospitals. No patient was harmed. The near error prevented others. Clara's relationship with Beatrice changed as the elderly nurse weakened. Beatrice had returned expecting to confess, deliver a key, and perhaps die. Instead, she became Hawthorne's first training matron. Her methods included habits from an earlier era that newer evidence challenged. She resisted abandoning aromatic fumigation, believing its strong smell proved cleansing. Clara and Okoro tested rooms and showed that ventilation and surface washing mattered more. Beatrice accepted the result reluctantly. Restoration did not mean treating every practice of the forgotten women as sacred. Their legacy was attention and courage, not infallibility. Beatrice trained 21 nurses before a winter illness confined her to bed. On her final morning, Clara brought Eleanor's ledger. Beatrice asked whether Clara wished she had spoken sooner. Clara could not answer gently without lying. "Yes," she said, "and I know why you did not." Beatrice nodded. Understanding did not erase consequence, but it allowed affection to exist beside it. She died that evening with treatment room 4's window open to clean winter air. The board named no wing after her at her own request. It created the Beatrice rule. Any worker threatened for reporting a safety concern received independent review and temporary wage protection. Her name lived in an action rather than a plaque. Clara continued searching Eleanor's final journey. The village infirmary where she died retained a burial register, but no personal effects. A retired porter remembered that Augustus arrived after receiving a telegram and took a leather case. The case likely contained the original drainage evidence. Most of it had since been recovered elsewhere. Clara wanted something intimate, a letter, a ribbon, any sign Eleanor thought of her child at the end. She found none for 3 years. Then, a railway archivist returned unclaimed parcels from the old coach company. One oilskin packet carried Eleanor Bell's name, an Ashcombe destination. Inside was a baby stocking, a pressed marsh flower, and a letter to Clara's aunt. Eleanor wrote that she had secured an investigator's promise, intended to return within 4 days, and accepted that exposing Augustus might cost her work and freedom. She did not describe herself as fearless. She wrote that she was afraid every hour and acted because fear would otherwise be inherited by Clara. The letter ended with a request: "Tell my daughter I did not leave her." Clara read it alone first, then placed a copy in the Hawthorne archive. The original remained hers. Public history did not require surrendering every private piece of grief. The east pump was dismantled after the new water main opened. Some wanted it destroyed. Clara asked that its stone housing remain in the clinic garden with an inscription listing the dates of contamination, investigation, and repair. The pump itself was sealed so no one could use it. Students visited to learn how observation became evidence, compare households, trace pipes, record rain, test samples, state uncertainty, change infrastructure. The lesson avoided a comforting myth that one clever person instantly solved an epidemic. Eleanor, Lady Hawthorne, Beatrice, Clara, Rose, laborers, analysts, council voters, and engineers each supplied part of the chain. Ashcomb's mill owners initially opposed sanitary inspections, then discovered that fewer outbreaks reduced absenteeism. Alderman Webb attempted to claim credit for the drainage program. Council minutes preserved his votes against it. Clara did not publicly humiliate him at every opportunity. She required accurate attribution in the annual report. Webb later supported a wash house because it benefited production as well as families. Mixed motives could still produce useful action when records prevented them from rewriting the past. Rose Fenwick trained as a nurse through Hawthorne's new program. She struggled with written examinations but excelled in household assessment, noticing where water vessels, waste, food, and sleeping arrangements created risk. The school redesigned training to value observed skill while providing literacy support. Rose became the first community nurse assigned to Marsh Cottages. Her children, whose recurring illness brought her to Clara, grew healthy enough to attend school regularly. Her daughter Edith chose her name in memory of the seamstress and later entered pharmacy training, determined that no wet label should decide another patient's life. Mr. Crane completed his sentence and returned to Ashcombe. Residents expected Clara to oppose him. He had entered Hawthorne, fought her, and nearly burned the ledger. He also preserved Eleanor's statement and testified against Harlan. The board debated whether to employ him when he applied as boilerman. Clara recused herself. The others hired him for a probationary period under supervision. Crane performed the work reliably and never asked Clara for forgiveness as payment for cooperation. Years later, he designed a lock requiring 2 keys to access archive heating controls, preventing any one caretaker from entering unseen. His contribution became part of the building without turning his wrong into virtue. Jonah Price led restoration until arthritis limited his hands. He and Clara developed a companionship built from long days, disputes over costs, and shared care for the place. When he asked to marry her, he did so in the unfinished south courtyard, while holding a repair invoice rather than flowers. Clara laughed before answering yes. They waited a year because Jonah's daughter feared marriage would replace her dead mother. Clara did not demand the child call her mother. Their household formed slowly. With separate memories allowed space, Jonah never treated Clara's work as temporary or expected her to leave nursing. Their marriage provided tenderness, not the conclusion of her public struggle. Dr. Okoro remained superintendent for 9 years. Larger hospitals eventually offered him genuine authority rather than subordinate posts. When he accepted a professorship in sanitary medicine, some board members accused him of abandoning Hawthorne after it established his reputation. Clara reminded them that an institution claiming ownership over a person's future repeated the logic they opposed. Okoro trained his successor, Dr. Helen Murray, and continued reviewing Hawthorne reports without fee. His departure demonstrated strength. The clinic survived because its governance did not depend on one good doctor. Funding remained a yearly concern. Hawthorne supported care through local rates, scaled fees, charitable gifts without control clauses, and paid training placements. In poor harvest years, income fell. The board postponed decorative masonry and protected wages, medicines, water testing, and roof maintenance first. One winter, it closed 6 beds rather than operate them unsafely. Newspapers called the reduction evidence of failure. Annual records showed why it occurred, and when beds reopened, sustainability looked less impressive than rescue but saved more lives. Hawthorne's 5th year brought a challenge that exposed another kind of omission. 3 women from outlying farms arrived in labor during the same storm. The clinic had 1 trained midwife, 2 suitable rooms, and no reliable carriage to transfer anyone. Clara converted the clean training room into a temporary third chamber and called experienced birth attendants from the villages. Dr. Murray, then Okoro's assistant, initially objected because the women lacked institutional certificates. Clara agreed they should not perform procedures beyond competence, but excluding their practical knowledge would leave patients with fewer hands. Each attendant worked beside a nurse, and every decision entered the record. All 3 mothers survived. One infant, born too early, did not. The case review found no single error. Yet it revealed that rural women delayed travel because Hawthorne's fees and rules were poorly understood. The board created published maternity charges, a hardship waiver, and a transport fund. Village attendants received formal training without being treated as ignorant intruders. Several later qualified under the county system. Cooperation replaced the old choice between unregulated isolation and professional contempt. The training program created conflict with a physician society that argued nurses were being taught to diagnose disease. Hawthorne's curriculum did not authorize diagnosis. It taught observation, drug safety, household sanitation, escalation, and documentation. Clara invited the society to inspect. 2 members arrived expecting radical propaganda and found students practicing pulse counts, bottle labels, water handling, and clear reports. One still opposed the program because he believed questioning orders undermined discipline. The other, Dr. James Wren, recognized that accurate nursing notes protected physicians as well as patients. He became an external examiner. His involvement did not soften Hawthorne's standards. It made them harder to dismiss as personal rebellion. Graduates entered hospitals across the county, carrying sealed copies of their competency records. Employers could no longer rely solely on informal character letters from men like Harlan. Clara's own censure remained in the first version of the county register even after the inquest cleared her. Clerks said historical entries could not be deleted. She did not ask deletion. She required a linked correction printed beside it at equal size. Years later, the register adopted a rule that amended findings must appear wherever original sanctions were cited. Reputation could not be restored if institutions preserved accusations in one book and corrections in another. Hawthorne's archive faced disaster when silverfish damaged the lower shelves. The old solution would have been to lock documents more tightly. Instead, the board hired an archivist who improved airflow, moved records above damp level, and created duplicate certified transcripts stored at the council and a university. Patient privacy complicated public access. Clara had used names from the 1,859 ledger to restore erased people, but living patients deserved protection from curiosity. The board established a closure period for clinical details and obtained permission before using teaching cases. The past suppression did not justify a new form of exposure. Eleanor's statement remained accessible because it concerned public wrongdoing, and Clara, as next of kin, consented. Edith Marlowe's family allowed her medication case to be taught without gossip about her private life. These policies turned memory into responsibility rather than spectacle. Not all descendants welcomed corrected history. One Harland relative sued to prevent removal of Augustus's memorial, arguing that a dead man could not defend himself. The trust agreed the dead could not answer, and therefore limited the inscription to findings supported by named records. It did not call Augustus a murderer. It stated that he diverted charity funds, ignored documented water contamination, falsified outbreak reporting, and obstructed inquiry. The court upheld the wording. Accuracy proved more durable than outrage. The removed bronze portrait was not destroyed. It entered the archive with context showing both his public honors and the evidence that reversed them. Students learned how respectable images survive longer than the decisions behind them. Ashcomb's water reforms expanded beyond one drain. Engineers mapped wells, cesspits, slopes, and flood routes. Householders objected when inspections entered yards. The council adopted notice requirements and appeal procedures, so sanitary authority would not become another unchecked power. Poor families received grants for required alterations. Fines alone would have punished people for conditions they could not afford to change. Mill owners contributed according to discharge volume. Webb resisted the formula, lost the vote, and later admitted predictable charges were easier to plan than repeated emergency closures. Within 6 years, severe intestinal outbreaks fell markedly. Hawthorne published numbers with cautions about population change and weather. Improvement deserved recognition without pretending. One intervention explained everything. Clara's deepest professional failure occurred during a winter pneumonia surge. Exhausted after 30 hours awake, she approved moving a recovering patient into a colder overflow room without noticing that the stove flue was blocked. The patient developed worse breathing overnight but recovered after Rose discovered soot and moved him. Clara filed the incident under her own name. The board required her to take 3 days rest and change staffing rules to prevent any nurse from authorizing transfers after excessive hours without a second review. Clara initially resisted, arguing that leaders carried unavoidable burdens. Rose told her that Harland used indispensability as an excuse to place himself above controls. The comparison hurt because it was true. Clara accepted supervision. Hawthorne's culture became credible when it restrained its founder as readily as a junior worker. A later benefactor offered a residence where nurses could rest between shifts. This time, the board accepted naming a garden, not a clinical wing, after the benefactor's mother, because the gift carried no governance conditions. Clara learned that refusal was not purity, and acceptance was not surrender. Terms mattered. The residence reduced errors and allowed nurses from distant villages to train. Its kitchen became the place where disagreements ignored during formal meetings surfaced over tea and were brought back for decision. Institutional health depended on ordinary spaces as much as charters. The manor grounds also changed. Marsh reeds were cleared only where drainage required. Because wholesale removal worsened flooding and destroyed useful habitat, a kitchen garden supplied herbs and vegetables but did not pretend plants replaced effective medicines. The old isolation yard became a laundry with clean and dirty routes marked by different paving stones. Jonah designed windows that opened from the top to improve air without chilling patients directly. Each repair linked the building's fabric to a practical lesson. Hawthorne looked less like the grand manor it once was, and more like the clinic its founders intended. Clara sometimes mourned lost beauty when damaged plaster and carved wood were removed. Preservation could not outrank safety. Selected fragments entered the archive, while sound materials were reused. Financial transparency produced an unexpected burden. People assumed every surplus should reduce fees immediately. The board had to explain reserves for roofs, outbreaks, salaries, and medicine shortages. One year's large balance prompted accusations of hoarding. The next year, a boiler failure and influenza wave consumed nearly all of it. And why? Annual meetings began showing not just present cash but projected risks. Residents gradually understood that sustainability was not hidden profit. It was the ability to keep doors open when donations followed other causes. Hawthorne never became free from money, politics, error, or grief. Its difference was that those pressures appeared in records accessible to people affected by them. 10 years after Clara first entered the abandoned manor, a severe flood covered the marsh road. Water entered low cottages and threatened the main supply. Hawthorne activated plans practiced each spring warning bell. Temporary water tanks on high ground, household lists, isolation rooms, dry food storage, and teams assigned before crisis. No one needed to wait for a heroic order. Rose's community nurses identified vulnerable families. Railway workers delivered coal. School children carried sealed instruction cards. The clinic treated injuries and illness. But the feared mass outbreak did not occur. Prevention left no dramatic pile of saved bodies. Its evidence was absence beds that remained empty, funerals that did not happen, names not added to a hidden ledger. The flood plan itself had been contested. When first proposed, several council members considered stored tanks and annual drills an unnecessary expense because Ashcombe had not suffered a major flood in 9 years. Clara used Hawthorne's oldest lesson: absence of recent disaster did not prove absence of risk. Jonah mapped watermarks inside abandoned cottages. Rose recorded which households lacked upper rooms. And railway workers calculated how long supply wagons required when the marsh road softened. The board approved a smaller plan than Clara requested, then expanded it after the first drill exposed missing carts and duplicate household names. Each year, the plan became less dependent on Clara. Team leaders carried copies. Keys hung in sealed boxes requiring 2 signatures. Tank water was rotated rather than forgotten. The work attracted no donations because rehearsal lacked the drama of rescue. Local rates funded it. When the severe flood finally came, Ashcombe did not discover readiness in a hidden room. It used habits built while skies were clear. Hawthorne also maintained agreements with neighboring towns. During Ashcomb's quiet years, its nurses traveled to assist 2 outbreaks elsewhere. In return, those towns sent pumps and blankets during the flood. The board recorded mutual aid as obligation, not charity received from generous outsiders. Communities became safer when help moved in more than one direction. A newspaper later credited Clara with personally organizing every response. She wrote a correction listing team leaders and published plans. The editor shortened it. Hawthorne printed the full account in its own report. Public stories preferred a heroine. Resilient systems required names in the plural. Clara kept working to ensure Eleanor's story was not simplified the same way. Eleanor had been brave. But she also relied on Lady Hawthorne's access, Beatrice's key, a coachman's secrecy, and records maintained by people whose names were lost. The archive created a research fund to identify unnamed attendants from wage fragments and family testimony. Some identities remained uncertain. Rather than invent satisfying answers, the memorial left blank spaces labeled "Record Not Yet Recovered." Honest absence belonged in history too. Years after Harlan's conviction, one former supporter brought Clara a box of tonic advertisements, council invitations, and letters praising Victor's charity. He expected her to discard them. She kept them. Future students needed to understand why people trusted him. He treated some patients competently, donated publicly, spoke calmly, and belonged to respected networks. Harmful authority rarely announced itself through constant cruelty. It survived by mixing real service with protected wrongdoing. Hawthorne taught students to judge systems and evidence without assuming charm or reputation settled either. This lesson made the clinic less vulnerable to replacing one revered doctor with another. After the flood, the town gathered in Hawthorne's Central Hall. The auxiliary patient tablets had been moved from the concealed graveyard wall and arranged at eye level. Recoveries and deaths were marked accurately. Eleanor's tablet stood among them, not above. Clara read Lady Hawthorne's successor clause, then turned the meeting over to the elected board. She was no longer the youngest voice in the room. Apprentices who trained under Beatrice now questioned budgets and proposed changes. A former patient chaired the session. This was the legacy Harlan's family feared, not a secret cure, but authority distributed among people once omitted from records. Treatment Room 4 remained preserved as a teaching room. Its clean cabinets held copies of the 1,859 ledger, water maps, Edith's restored nursing entry, laboratory reports, and every later policy revision. The desk still showed a dark oil mark from the attempted fire. Clara refused to sand it away. Beside it sat 3 glass jars sealed samples from the old East pump, the manor spring before protection work, and the current public supply. The water looked equally clear. Labels told the history's appearances could not. Visitors often asked Clara when she knew she had defeated Victor Harlan. She answered that defeat was not the useful measure. Harlan lost his license and freedom, but Hawthorne succeeded only when a nurse could question a dose without exile, when a poor mother's observations entered a case review, when a doctor's mistake remained in the record, and when clean water reached a house whose residents would never know Eleanor Bell's name. Justice mattered because it changed ordinary practice. On the anniversary of Hawthorne's reopening, Clara walked to the capped East pump with Eleanor's letter in her pocket. Jonah and his daughter waited at the garden gate. Giving her privacy, Clara placed the pressed marsh flower beneath the glass of Eleanor's tablet. She had spent childhood imagining an absent mother who chose another life. The truth was both kinder and crueler. Eleanor had tried to return. Powerful men stole her time. Nama. And final message. Clara could not restore the years between them. She could restore the choice Eleanor made when she recorded what others preferred not to see. Evening air moved through the manor grills. Lights appeared room by room: the maternity chamber, training hall, dispensary, kitchen. And northward, 28 years earlier, the town sealed Hawthorne and called silence safety. Now its doors remained open, under rules strong enough to protect patience and truth together. Clara turned from the pump toward the entrance. Above it, the old stone name, Hawthorne Manor. Clinic had been cleaned, but not replaced. Beneath, a newer line read, "Record carefully. Question safely. Serve openly." A young night nurse held the door for Clara. then paused over a medicine sheet where two amounts did not agree. She did not whisper or wait until morning. She rang for the physician and marked the discrepancy in ink. Clara passed her without intervening. The system was already answering. Behind them, treatment room. 4 remained dry, not because a frightened woman secretly fed its boiler, but because workers inspected the roof. The accounts funded coal, and the board published who held every key. Hawthorne had not rescued Clara by revealing a hidden fortune. Clara and the people, once erased from its books, restored the clinic by making memory practical. As the door closed against the cold, the ventilation ducts carried clean air through every occupied ward.